This is Dr. Aajay Shah, and we are talking about heart attack and stroke prevention tips. Let's first review how the heart attack and stroke happen. Every organ of the body requires blood flow to bring nutrients and oxygen to survive. Heart being the main organ to pump the blood requires obviously a lot more blood than other organs. Similarly, brain, a continuously working organ, also requires lots of blood flow. When lack of blood flow happens, the cells in the whole body start suffering, and if the lack of blood flow continues for a long time, eventually the cells die. Obviously, brain, heart, kidneys, being the vital organ, cannot suffer too long without blood, knowing that they have to work continuously. The most important cause of lack of blood flow to the organ is plaque buildup in the arteries which supply that organ. So for example, for the heart, if there is a plaque buildup in coronary arteries or arteries which supply blood to the heart develop plaque, then heart muscle cell will suffer. If the artery to the brain has plaque, stroke can happen. So let's talk about the plaque itself. We have realized over the last 25 years that with the risk factors like diabetes, high blood pressure, smoking, the walls of the artery start building plaques. The plaque typically is made out of cholesterol, scar tissues, and calcium deposits. The plaque buildup starts at age 20, which is many times surprise for most of my patients to know. When Korean soldiers unfortunately died in the war and they were brought back to mainland and autopsies were performed, in the soldiers who had history of genetically high cholesterol, they already had plaque buildup in their aorta, the main artery of the body, starting age 20. So again, let me repeat. The plaque buildup starts as early as age 20. Over the years, the plaque gradually builds up more and more, and eventually it builds up to 50%, 60%, and once it gets up to 70% or more, the flow through that artery starts getting less and less. And that's when the organ which is supplied by that artery where the plaque is starts suffering. For example, if the artery supplying blood to the heart has plaque buildup, a person will develop chest pain, which will come on exertion, knowing that on exertion, heart will need to work hard, it will need more blood, and because of plaque, the blood flow cannot be kept up while a person is exercising, and there will be signs of lack of blood in the form of chest pain, and we call it angina. I'm sure you have heard the term angina all the time. Once the blockage gets worse and worse, it can completely close the lumen, and there's a complete stoppage of blood flow, and that's when heart attack happens. The reason we worry about plaque buildup at early level, because even when the plaque is only 50%, the plaque can rupture, like a crack can happen in the plaque, and that crack can lead to bleeding at the plaque site, and eventually a clot at a plaque site, instantly filling up the remaining of the opening within the artery and causing a heart attack. So again, let me repeat. Even when the plaque is only 50% blocked, it can lead to heart attack if the plaque cracks or plaque ruptures. So what are the causes of plaque buildup? Let's go to the next track and learn about risk factors for developing heart attack and stroke. Again, this is Dr. Aajay Shah, and you are listening to Heart Attack and Stroke Prevention Tips. Thank you.